Hello everyone, my name is Surya and you are with me today to study or learn about the anatomy of heart. And as you know, this is our third session. We already completed part 1 and part 2 of anatomy of heart, and you're watching Nurse Talk with me. And in the last two sessions we discussed in detail about the structure and layers of the heart, the valves inside the heart, and the blood flow in the heart. Today we will see the coronary circulation or the circulation to the heart muscles. Okay, so I hope you can see this shared image where I am showing the coronary arteries. See, in the last video I mentioned you, just in case if you haven't watched the last two videos of anatomy of heart part A and part B, I humbly request you to go back and watch it before seeing this one or before learning this part, because it will be far more easier for you to understand what I am saying in here. Okay, thank you very much and sorry about that. Okay, so this is the aorta. We were mentioning about the aorta in the last video, and we said there is a coronary arteries branching from the aorta providing blood supply to the cardiac muscles. Okay, so there are two coronary arteries. The first one is the right coronary artery, you can see here, and then the left coronary artery here. So I am going to show different colors. For the right coronary artery, I am going to show it in an yellow color, so it will be easier for you to understand. This coronary artery provides, they are beginning from the ascending aorta. This is ascending aorta. They are beginning from the ascending aorta, and they will provide blood supply to all the parts of the heart. Okay, so from the right main coronary artery. Okay, so just remember this yellow color is for the right. From the right main coronary artery, where is the right coronary artery supplying the blood to? You can see the right coronary artery is supplying. Here is a branch coming. It is supplying to the right. Sorry, in here it is the right atrium. They are supplying to the right atrium. Okay, and it's supplying to the right ventricle in here. And can you see a branch coming down like that? Yeah. So this is going to the inferior portion of the left ventricle. Inferior portion of the left ventricle. And it is also supplying to the posterior septal walls. Here is a septum in here. We will discuss in detail about the septum and septal defect in the congenital heart abnormalities. That time we will discuss in detail about each ventricles and atrium. So it will be easier for you to remember what is happening inside the atrium and what will happen if there is a defect in the septum between the atrium. So that's why I am not doing it now, because I think it will be more easier to you to remember when you study it in connection with the disease condition, because we are getting questions. We are not getting questions just from the anatomy. We are getting questions from every corner of your textbook. So we have to learn it all in detail. So, sorry, coming back to the right coronary artery. So the right coronary artery supplies blood to right atrium. It's very easy to remember. Right coronary artery supplies blood to right atrium, and it supplies blood to the right ventricle in here, and it also supplies blood to inferior portion of left ventricle. You can see this branch coming from the right artery to the inferior portion of the left ventricle, and it also supplies to, here is the septum in here. Okay, septum is blue in color. Okay, here is a septum between the atria. This is atrial septum, and between the ventricle, this is the ventricle septum. So this also supplies to the posterior wall of the septum. Okay, the posterior septal walls. And another important point is coronary artery supplies to SA node and AV node. In this class itself, we are going to study in detail about the SA node and AV node. Okay, so don't worry, you don't get panic or anything. So this is SA node and AV node. In case if you get a question like, which artery is supplying to the SA node and AV node of the heart, the answer is right coronary artery. So did you get an idea of what where are they supplying the bloods to? Okay, so from the ascending aorta arises two arteries, right coronary artery and left coronary artery. We are discussing about the right coronary artery, which supplies blood to the right atrium, right ventricle, inferior portion of the left ventricle, and posterior septal walls in here, and also the SA node and AV node. To be honest, SA node and AV node are present in the outer surface of the eye in the right atrium itself. So it's very easy to remember. Right coronary artery supplies to SA node and AV node. And the only thing is left ventricle. What part of the left ventricle? Only inferior portion of the left ventricle is supplied by the right coronary artery. Okay. So now we are going to the left coronary artery. So we'll use red for left coronary artery. So left coronary artery, we can see the left coronary artery arising from this ascending aorta in here, and it is dividing into two branches. You can see here left anterior descending artery, and another branch going to the back side of the heart is left circumflex artery. Okay, the left coronary artery rising from the ascending aorta divides into left anterior descending artery and left circumflex artery. So left coronary artery has two branches. Left coronary artery has two branches. First one is left anterior descending artery and next one is left circumflex artery. Okay, so this is a most important point comes in here. Okay, left anterior descending artery supplies blood to, so we all know this is left, so they are going to the left side. Left anterior descending artery supplies blood to anterior wall of the left ventricle. You can see anterior wall of the left ventricle, anterior ventricular septum. You can see the septum in here. We said the posterior wall of the septum is supplied by the right coronary artery. Anterior wall of the septum is supplied by the left anterior descending artery, and apex of left ventricle, the apex part. We already learned about the apex and base of the heart in detail in the first video. Like the anatomy of heart part A, we learned in detail about the apex and the base of the heart. So the apex of the heart, this last portion, this conical portion is also supplied, the blood supply is done by the left anterior descending artery. Okay, anterior wall of the heart, anterior wall of the septum, anterior ventricular septum, and then it's coming apex of the left ventricle, apex of the left ventricle. These three are supplied, the blood supply is done by left anterior descending artery. So where is it? Anterior wall of left ventricle, anterior ventricular septum, then apex of left ventricle. Okay, so this is the left anterior descending artery. Now we are moving to the second branch of left coronary artery is left circumflex artery. So the left circumflex artery supplies to left atrium itself in here, and also the lateral and posterior surface of left ventricle. It is going behind. You can see, cannot see the artery in this image because it is running backwards, so it's going behind the heart. So obviously they are going to supply there in the lateral and posterior surface of left ventricle. Okay, so I hope got an idea. We will say it again now once more so you can refresh or get or get more idea about the topics what I'm trying to say. Okay, again here once more we are going to discuss about the coronary arteries. Be easier for you to remember. Okay, so I'll use blue. Okay, first we are going to talk about the right coronary artery. It is a branch coming from ascending aorta, and this right coronary artery, right coronary artery supplies blood to right atrium, right ventricle, inferior portion of left ventricle, posterior septal walls, and SA node and AV node. So you can write it down. Right coronary artery supplies to right atrium, right ventricle, SA and AV nodes, posterior septal walls. Okay, so this is the blood supply going to the going from the right coronary artery. Now we are going to the left coronary artery. It's blue. Left coronary artery has two branches, left anterior descending artery and left circumflex artery. We'll talk about left circumflex artery first because it's easier. Best with left circumflex artery is going behind, going back. So left circumflex artery supplies blood to left circumflex artery supplies blood to the left atrium and lateral and posterior surface of left ventricle. Okay, so left circumflex artery supplies to left atrium, lateral and posterior surface of left ventricle, and the other branch is left anterior descending artery. This supplies to anterior wall of the left ventricle. See, we can see it coming, anterior wall of the left ventricle, anterior ventricular septum, anterior, because posterior is supplied by the right atrium, so right coronary artery. So anterior ventricular septum is supplied by left anterior descending artery and apex of left ventricle. So the most common question asked from this topic is about left anterior descending artery. Do you know why? The most common, you heard about myocardial infarction or MI. Myocardial infarction. So that's a disease condition. We will discuss about it later. So most of the myocardial infarctions is caused by anterior wall MI. That means the blood supply to the anterior wall of the left ventricle is affected, and hence the myocardial infarction happens. So who is supplying to the anterior wall of the left ventricle? We all know the left anterior descending artery is supplying to the anterior wall of the left ventricle. So the left anterior descending artery is also known as widow's artery. Why? Because most of the people die because of the myocardial infarction happening to the anterior wall of this anterior wall MI. So most common type of myocardial infarction is anterior wall MI, and it is a left anterior descending artery supplies blood to the anterior walls, and if there is any problem or disturbances in the blood flow towards the left anterior descending artery providing blood supply to the anterior wall of the heart, the patient will result in anterior wall MI. That's a type of myocardial infarction. That's why this is known as the widow's artery. So this question has been asked many times, and it depends upon the way the questionnaire wants it to be. So first question is, what is the another name of left anterior descending artery? And it is widow's artery. Otherwise it can be asked like, which artery is known as widow's artery? It is again left anterior descending artery. The other question is, what is the common, where is the blood supply affected in case of a patient who is having an anterior wall MI? So that is also left anterior descending artery. Remember, left anterior descending artery cause anterior wall MI because they are providing blood supply to the anterior part of the left ventricle. I have already mentioned many times, in the heart there are 4 chambers, and all the 4 chambers are very, very important. Among that, the most important chamber will be the left ventricle because they are pushing the blood out to the aorta to all the parts of the body, and the pressure inside the left ventricle is also the highest in order to push the blood outside. So in case if the anterior wall of the left ventricle is affected, the patient is going to have a severe condition, that is anterior wall MI. And this wall, which if in case if they ask you which artery is responsible for anterior wall MI, it is left anterior descending artery. Okay, I hope you got an idea about the different 2 types of arteries and the branches of left coronary artery. They are left anterior descending artery and left circumflex artery. Very easy to remember left circumflex artery because we can see it is going backward of the heart. So that is providing blood supply to the left atrium and also to the posterior and lateral aspect of the left ventricle. Then we studied about left anterior descending artery, major cause of anterior wall MI. So it is also known known as widow's artery, and left anterior descending artery supplies blood supply to the left anterior wall of the left ventricle, anterior ventricular septum, and apex of the left ventricle. Apex of the left ventricle is also supplied by left anterior descending artery. Remember, apex of the ventricle is supplied by left anterior descending artery. Inferior part of the left ventricle is, this is the inferior part of the left ventricle. It is supplied by the right coronary artery. Remember, that is a confusing fact that can be that can make you confused while you are in the exams. Okay, so I hope you got an idea about the coronary arteries and which part of the heart they are supplying to. Okay, now we are going to another important topic, that is cardiac conduction system. If you remember, when I was saying about the blood supplies areas of right coronary artery, I mentioned about the SA node and AV node. So what is SA node and AV node? Just push it to this side so I can get some space in here to write. Okay, so SA node and AV node. SA node is sinoatrial node. It is situated between the superior vena cava here and the right atrium. So this is the SA node. The function of SA node is to initiate the impulses for contraction of the heart. We all know in the first class itself we studied the blood is pumped out, even if it is to the lungs or it is to the aorta. The blood is pumped out because of the contraction happening in the ventricles. Okay, we all know the heart is contracting and relaxating in order to push the blood outside the heart and to get it to every part of the body. So in order to, who is contracting the heart? It's like a very normal question. You can ask it yourself. We know the heart is contracting. How is it contracting? Is anybody pushing the heart inside our body? No. But there is some impulses or electrical charges that is helping in the contraction and relaxation of our heart. Imagine how efficiently this is made, like how efficiently the functioning or the working of heart is made. I don't know who made it, like maybe I believe in God, so I think that is the one who made the heart in such a perfect way that we are living or the heart is beating. The magic, I think the heartbeat, one heartbeat itself is a magic that's happening inside our body. So coming back to the session, so this is a superior vena cava and this is the right atrium, and there is a node in here, SA node, which create the impulses. Okay, which create the impulses, and this impulse travels to all part of the heart to help it to contract and relax. So how is this going to happen? So we can see the SA node in here. SA node is also known as natural pacemaker. SA node is also known as the natural pacemaker because it initiates the impulses for contraction. It is situated in the junction between the superior vena cava and right atrium. So, how many of you know the normal pulse rate of a human body? I would say the normal pulse rate of a human body is going to be 60 to 100 beats per minute. Why I am saying it here? Because it's very easy to remember if you know the pulse rate that the SA node is generating 60 to 100 beats of impulses per minute. Very important. How many impulses are they producing? In a minute, they are producing 60 to 100 beats, 100 impulses. That is the number of electrical impulses they are producing in the SA node. Okay. So, how I learned the number of impulses produced by SA node is normal pulse rate of a human body 60 to 100. Normally it comes up like 70 to 74. So the range is 60 to 100, and that is the exact number of impulses produced by the SA node in a minute. Okay, so you got the number as 60 to 100, and the SA node is known as a natural pacemaker of our heart. And this is controlled by the sympathetic and parasympathetic nervous system. Okay, so this is SA node. Now we are moving to the AV node. Okay, you can see AV node here, AV node. This is atrioventricular node. It's very, very easy to remember the AV node because it comes between the atrium and the ventricle. You can see it between the atrium and the ventricle. This is atrioventricular node. And the SA node is transferring it signals or impulses to the AV node. And how is it transferring? There are internodal fibers here. Internodal fibers. Internodal fibers. So I think that is also very easy to remember because the node between, the fiber between two nodes are internodal. Nodes and nodes. SA node and AV node is connected by internodal fibers. So see, the internodal fibers connect the SA node and to the AV node. AV node is the atrioventricular node. Okay. This transfer impulses to the this intraventricular node transfer impulses to the AV node. Okay, so if the SA node fails to work, AV node. If the SA node fails to work, that means the SA node is not making or not generating 60 to 100 beats per minute. It just stopped it functioning. So what will the AV node do? The AV node will take that responsibility and they will function a heart rate of 40 to 60 beats per minute. Okay, so even if the SA node fails there, AV node will take the responsibility. But you know, AV node is not as capable as SA node to produce the beats per minute because that is not their function. It was the function of the SA node to take the impulses or to generate the impulses. But if it fails, yes, still the AV node can manage and it will make 40 to 60 beats per minute. So how will you remember the number? This is a 40 and 40 interval. 60 to 100 is another 40 interval and now comes 40 to 60. Okay, 40 to 60 beats. AV node can make 40 to 60. At least you make us leave. Okay, if the SA node fails, AV node can initiate and sustain a heart rate of 40 to 60 beats per minute. And the conduction velocity of AV node is very, very important. Conduction velocity. Conduction velocity of AV node is 0.05 meter per second. That is the velocity of AV node. And the impulses from the AV node takes a little bit of time gap to before transmitting this to the bundle of His. This is bundle of His. Okay, we'll go to the bundle of His after AV node. So this AV node is going to take another color. This AV node is going to transfer that impulses to the bundle of His in here. Okay, and this bundle of His will differentiate into right and left bundle branch and to the Purkinje fibers to spread these electrical impulses all over the heart. So from the AV node to bundle of His, there is a small time gap, or this is a, there will be, it will take some time for the transfer of the impulses, and this time is about 0.08 to 0.08 to 0.08 to 0.1 second is the time gap the AV node is going to take before they transfer the impulses to the bundle of His. So we got an idea. SA node is generating impulses and it is transferred to the AV node. And the AV node is going to transfer the impulses to bundle of His. But before that, it will take less than 1 second. Like this is a small, very, very small time. 0.08 to 0.1 second before transferring this blood. Why are they taking this time? This delay is not called AV nodal delay. AV nodal delay. Okay, so do you know what is happening here? The AV node is sending an impulses to the bundle of His, and if the bundle of His receives that impulse, they are going to spread it through the right and left bundle branch and to the Purkinje fibers in here, and the heart will contract. Okay, but what if there is no blood inside the heart? So the AV node is giving some time for the heart to fill the ventricles with the blood, so that once the impulses reach the Purkinje fibers, they can contract and push the blood outside the left ventricle and right ventricle. Okay, so this AV nodal delay, is giving time. It provides enough time for the emptying of blood from the atria, for the contraction of atria, and the ventricles to have enough blood before the contraction. Okay, did you get what AV node delay is? So we learned about SA node. It's a natural pacemaker of the heart. They will make 60 to 100 beats per minute impulses for the contraction and relaxation of the heart. And once the SA node the SA node impulses is created, they will move to the AV node, and from AV node they will move to the bundle of His. From bundle of His, they will move to the right bundle branch here and the left bundle branch here. They will divide into Purkinje fibers, and hence the electrical impulses reaches every part of the heart. Okay, and I said SA node creates 60 to 100 beats of impulses per minute, and if the SA node fails, AV node still can make some impulses, that is 40 to 60 beats per minute. And the time gap between the impulses traveling from AV node to bundle of His is 0.08 to 0.1 second. That is a time gap, and this time gap is known as AV nodal delay. The purpose of this AV nodal delay, or this time taking for the AV nodes to transfer the impulses to bundle of His, is because this delay provides enough time for emptying of blood from the atria and then the ventricles for pumping. So they are giving some time. The time is very little. 0.08 to 0.1 second is a nodal delay. They are giving this time for the ventricles to fill up with enough blood and also the atrium to empty their blood chambers. Okay, so this is what happens during the contraction. Okay, so I said if the SA node fails, AV node will make some beats, 40 to 60 beats per minute. What if the AV nodes fails? If the AV node fails, it will go to the bundle of His, and this bundle of His can also make some impulses. Okay, the bundle of His can also make some impulses. So this bundle of His, from AV node, action potential enters the AV bundle located on the right side of the interventricular septum. This bundle of His is on the right side of the we can see the ventricles in here. We can see the ventricle. This is the ventricles, two ventricles, and this is the ventricular septum. It's on the right side of the interventricular septum, and it will not, like that, there is no retrograde conduction. So once the bundle of His receives the conduction, it is only going down. There is no going back here. Okay, so there is no retrograde conduction, and the speed of conduction here is 1 meter per second. So what was the velocity of AV node? It was 0.05 meter per second. Here it is 1 meter per second. So this is AV node is faster than bundle of His. So bundle of His will receive the impulses, and then from here it is going to the left and right bundles, and then it receives the Purkinje fibers. Yes. So we were saying that if the SA node fails to make 60 to 100 beats per minute, AV node can manage with the 40 to 60 beats per minute. What if the AV node fails? If the AV node fails, so this bundle of His will receive whatever the impulses we got, and then it is going to the Purkinje fibers. This Purkinje fibers in here can also make some impulses. It is 20 to 40 beats per minute. This question has been asked. So if the SA node and AV node fails for a person, how many beats per minute impulses can be produced by Purkinje fibers for a person to survive? That means the heart still beats, but the heartbeat is going to be only 20 to 40 beats per minute, and this impulses is produced from the Purkinje fibers. So did you get an idea of heart conduction system? Yes. Okay. We'll say again once more. First we'll go to the coronary artery again. So this is a revision. Remember it and listen to it carefully. This ascending aorta in here, I'm just going to use black for everything here. Ascending aorta in here have two branches, right coronary artery, left coronary artery. Right coronary artery supplies blood to right atrium, right ventricle, inferior portion of left ventricle, SA node and AV node. Okay, and then also the posterior part of the septum, posterior wall of the septum. Okay, then we studied about left coronary artery has two branches, left circumflex artery and left anterior descending artery. Left circumflex artery provides blood supply to the left atrium and also the posterior and lateral walls of left ventricle. Then we studied about the left anterior descending artery supplies blood to the very important part of the heart, that is left ventricle, anterior part of the left ventricle, apex of the heart. Okay, so the most common type of myocardial infarction seen in the patients is anterior wall myocardial infarction or anterior wall MI. So the artery responsible for anterior wall MI is left anterior descending artery. Left anterior descending artery. It is also known as widow's artery because most of the people die of myocardial infarction happening to the anterior wall. So that is it is known as widow's artery. So did you get an idea about the coronary arteries and where they are supplying to and what is the pathological importance of coronary artery? Okay, now then we move to the cardiac conduction system, and in the cardiac conduction system we mentioned about the natural pacemaker of the heart. It is SA node create impulses and transfers it to the AV node through internodal fibers. So internodal fibers transfers the impulses to AV node. SA node create 60 to 100 beats per minute impulses and goes to the AV node. This AV node in here also make impulses, that is 40 to 60 beats per minute. And this AV node transfers the impulses to the bundle of His in here. Okay, this bundle of His will transfer the impulses to the Purkinje fibers, and this Purkinje fibers will help in the contraction and relaxation of the heart. If the SA node and AV node fails, Purkinje fibers can also generalize impulses, that will be 20 to 40 beats per minute. Okay, there is a time gap between the impulses transferring from SA node to AV node. This is called AV nodal delay. The time between the transfer or AV nodal delay is 0.08 to 0.1 seconds. Okay, very important. This is AV nodal delay. The purpose of AV nodal delay is they are giving time for the ventricles to get collected with the blood, or they are giving time for the atria to empty their atriums and provide all the blood supply to the ventricle. So this is the heart conduction system, and once this SA node create an impulse and go to the AV node and goes to the bundle of His and there to Purkinje fibers, once it reaches the heart muscles, once the impulses reach the heart muscles, the heart will start contracting and relaxing. So cardiac conduction system is one of the very important topic, as well as the coronary arteries providing to different parts of the heart muscles. That's also a very important topic. Hope you understood the video and keep supporting me, keep watching the video. In case if you are having any questions or if you want any particular topic to discuss in here, you can pop it in the comments and I will get back to you. Thank you very much for watching. See you with another session. Bye bye.